News tonight, CVS is vowing to kick the habit. We're talking about tobacco. By October. It's a big move that's being praised by health groups, but it will cost the drugstore chain billions in the process. Rachel Kingston is taking a closer look at today's major announcement.
Yeah, they have a history in Europe.
Lawmakers and public health researchers predict that CVS Pharmacy's decision to stop selling tobacco will have a major impact on the cost all New York taxpayers shoulder for health care.
In New York State, there's $8 billion of medical care that goes every year towards tobacco-related diseases. Of that, $3 billion we all help pay through Medicaid.
Bottom line is there's not a body system that is unharmed by tobacco. So you're looking at huge burden from heart disease, stroke, and obviously cancer.
CVS is the first major national retailer to cease tobacco sales since Target did so in 1996. Wegmans did it in 2008. And most of the independently owned local pharmacies have not sold cigarettes for about the last 10 years.
We did a survey of local pharmacists, and what we found is that the large majority of them didn't think that their pharmacy should be selling tobacco products.
How do I treat my patient for a heart disease brought on by smoking? And then when I ring them out for their medication, I also ring them out for a few packs of cigarettes.
When cigarettes disappear from CVS stores, so will the advertisements that go along with them, something researchers hope will cut down on the number of kids who are enticed to become new smokers.
And there's other studies that show that kids are particularly attuned to that, and that kids that frequent stores where there's a lot of retail advertising are more likely to start smoking.
New York has no state laws restricting tobacco sales in pharmacies, but there is currently a bill in the legislature.
My hope is that we never have to pass that legislation because the corporations themselves step up to the plate.
The timing of this decision by CVS might be a little strategic. As we told you last night at 10, the FDA is planning to unveil a new series of anti-tobacco ads next week, which will be aimed primarily at teens and adolescents who either already smoke or are at risk to start smoking. Rachel Kingston, News 4 at 10.
Thank you, Rachel.